Mr. President.
Senator from Montana.
Thank you, Mr. President. And thank you, Senator Moran, for your kind comments. I first want to start out my comments by acknowledging the chairman of the Senate Veterans Affairs Committee. We would not be here today taking up the VA Missions Act without the leadership of Senator Johnny Isakson from Georgia. He is a fierce advocate for veterans, and he has been an incredible pleasure for me to work with. The bipartisanship and the collaboration on our Senate Veterans Affairs Committee happens because we leave politics at the door. And that is possible because of Johnny's personality and Johnny's leadership style, as well as his commitment to the veterans of this nation. I'd also like to thank the many veteran service organizations who have weighed in and provided positive feedback on the VA Mission Act. 38 veterans organizations representing millions of veterans and servicemen and women nationwide support the VA Mission Act. They have been asking for choice reform and responsible investment in the VA, and this bill gets it done. And I also want to thank the House Veterans Affairs Committee for working with us and getting a bill drafted that we can all be proud of. At the beginning of this Congress, we set out to draft a bill that reforms community care and also strengthens the VA. As Senator Moran pointed out, coming from a state like Montana, a rural state, 147,000 square miles, I know you cannot have a VA clinic in every community. But veterans cannot always drive 2 hours to the nearest VA clinic. And they certainly can't afford to wait months for an appointment. And that is why we need private health care to fill in the gaps when the VA cannot deliver that health care. But I also know how much veterans need the services they get from a VA clinic. In my dozens and dozens and dozens of face-to-face listening sessions with veterans, they have told me that the kind of care they get from the VA is important. They are surrounded by their peers, many of whom have experienced mental and physical implications of being in combat. VA doctors and nurses know how to treat PTSD, toxic exposure, and other wounds unique to their service. The best defense against any effort to privatize the VA or sending veterans wholesale to private sector is to make sure that the VA is living up to our promise to the veterans. The VA Missions Act recognizes that there is a balance between the VA care and community care, invests in medical and clinical staff to serve veterans at the VA. It builds the capacity within the VA, and it uses private sector to fill in the gaps when the VA falls short. It takes the bill that Johnny and I wrote, the Caring for Our Veterans Act, and adds a few things. But the foundation of this legislation is something that Senator Isakson and I have written over the course of the last year with veterans groups. So I'm incredibly proud to be standing here today to hopefully push this bill to the President's desk. The Choice Program was created with an important mission: to make it easier and faster for veterans to get health care. It hasn't worked like that for many veterans. Veterans like Tom, retired U.S. Navy commander of the Vietnam War in Montana. In his 24 years as a Navy pilot, Tom spent a lot of time yelling to be heard over the roar of an engine. It took a toll on his ability to hear. 3 years ago, he began the process of getting hearing aids for the VA. He got his hearing aid test done, but when it came time to order the hearing aids, Tom was told that he wasn't authorized. The nearest VA facility to Tom was almost 3 hours away, so he and his wife decided to drive to the closest civilian clinic, which was about 45 miles away in Sandpoint, Idaho, just across the line from his home in Knoxon, Montana. Here he hit another snag. After weeks of back and forth visits, the authorization was again denied because he was not a resident of Idaho. So he returned to square one. He drove 5 hours to Fort Harrison in Helena, 250 miles away. And with assistance from my office, he got the authorization for those hearing aids. Tom had to drive 2 5-hour round trips to a choice provider in Kalispell, but a few months later, he finally received his hearing aids. All in all, Tom drove nearly 20 hours to get those hearing aids, and I'm here to tell you it shouldn't be that hard for a veteran to get the health care that they've earned from the VA. And you know what the worst part is? There's an audiologist in Tom's hometown the entire time that could have helped him. If the VA would have just realized how important it would have been to access that audiologist instead of driving 20 miles on the road. Unfortunately, Tom is not the only veteran with a story like this. I can tell you about a veteran in Lake County who had several appointments scheduled through the choice program, and then he was told he wasn't eligible for choice at all after his appointment. When he caught pneumonia, my office stepped in, got him the care he needed through the choice program. Or I can tell you about Bruce, a veteran in Billings who couldn't get a follow-up appointment through the choice program after his hip surgery. He was told he wouldn't wait more than 5 days, and then he couldn't get anybody on the phone. We were able to help him get the follow-up care that he needed. Or Terry in Butte, who got a procedure done through the choice program. It was approved, completed, and then he was told that he didn't qualify for the choice program. Again, the U.S. Senator had to step in, so Terry didn't have to foot the bill for his health care. I could go on and on. Veterans across the state of Montana have called my office for help since the choice program was started. Their frustration over issues like scheduling, reimbursement, or traveling long distance for care are a sorry way to say thank you to those folks who have served this country. But, Mr. President, it shouldn't take a Senate office stepping in to make sure that the government lives up to its promise to America's veterans. So Chairman Isakson and I wrote a bill that reforms the entire system. We negotiated with the House, the White House, veterans and advocates to move our bill forward. The Caring for Our Veterans Act was a giant step forward, and thanks to the leadership of the House Veterans Affairs Committee and our effort, the Caring for Our Veterans Act is included in the VA Missions Act. Our bill gets rid of 7 different community care programs, including choice, and replaces them with one community health care system that streamlines set of rules for veterans and local providers and VA staff. It will be much easier to understand. Under the Missions Act, if a veteran wants to get care in their community, they can have a discussion with their doctor and decide what's best. VA doctors and nurses won't have to spend time figuring out which program to refer a veteran to. And local providers who see veterans won't be waiting months for payments from the VA. A new streamlined payment system will make sure that they're getting paid in a timely manner. And our bill holds the VA accountable and requires them to create a business plan to tell us exactly how the agency will spend taxpayers' dollars if and when they ask for additional funding. Our bill brings more providers to work at the VA, especially in rural and tribal areas and vet centers. And it breaks down barriers along state lines. It prevents veterans from accessing mental health care closer to home. And the bill also expands the VA Caregivers Program to veterans and their caregivers of all eras. This was a provision that Senator Murray worked on very, very hard. It was the right thing to do, and Senator Isakson made it a priority of his. The VA and community care are equally important, as the VA healthcare system knows that it will either starve the VA to death and empower the rural community hospitals, or as this bill does, excuse me, strikes a balance the right balance between investing in VA's ability to provide the care for our veterans, cutting the bureaucracy, and when it makes sense for the veteran, for that veteran to be able to go to a local doctor. The VA Missions Act is a bold bipartisan product of working together that puts health care decisions in the hands of the veterans, breaks down barriers to health care wherever it makes sense for the veteran to go get the care that they need. This nation owes our veterans much more than a thank you. Veterans deserve a health care system that works for them, regardless of where they live, what medical condition they are struggling with, or whatever their means. Our bill gets rid of the one-size-fits-all system and creates a more efficient and easier to navigate system for veterans. I would urge the Senate to pass the VA Missions Act to send a message that saying thank you isn't enough for those who put their lives on the line for our nation. We're going to deliver them a health care system that is worthy of their service. Mr. President, I would turn the floor over to Senator Johnny Isakson, Chairman of the Senate Veterans Affairs Committee.
President.
Senator from Georgia.
Mr. President, before the senator from Montana leaves, I want to thank him for 3 years of dedicated service to the committee, the last 2 in particular, as we put together the pieces of the shrapnel, which was the original attempts to make choice work, to be a streamlined program that's going to work for all of our veterans. And Jon Tester has been a magnificent ranking member, magnificent leader, and I appreciate very much the kind of things he had to say about me, but I say ditto to you.